Thinking about PRP for thicker hair, are there any associated risks? I'm a 35-year-old man. Hello, I'm considering PRP to thicken hair. I read on one chat forum that there could be a link with cancers. Can anybody put my mind at rest, or should I simply avoid such treatment?
Thank you for your question. You submitted a question without a photo, and you stated in your question that you're interested in thickening your hair with PRP and that you're 35 years old, but then you read on a forum that there's a link between PRP and cancer, and so you're asking about that particular concern, and naturally you want to make sure that there's no significant risk like cancer associated with PRP. Well, I can certainly share with you how I discuss PRP with my patients in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed which began with the use of PRP and a material called extracellular matrix, which has become a very significant path to helping people with hair loss non-surgically for both male and female pattern hair loss. And I'll discuss this a little bit further as I discuss the concerns you have with your question. So, to understand the time we're in terms of the role of PRP with hair loss, I have to say that I'm reflecting on a lot of years of experience with PRP. In fact, in our practice as a cosmetic surgeon, we use PRP very routinely. We use it for wrinkles, we use it for acne scars, we use it for under-eye dark circles, and as I said earlier, we have combined PRP with a material called extracellular matrix for the treatment of male and female pattern hair loss. Now, to go further into how people are doing research in the modern world, we often use in the medical field the term Dr. Google, and essentially everyone does research by going on the web. And that's a fact of reality, especially in the practice of medicine. The challenge is being able to distinguish good, useful information versus information that is being bounced around without having any clear understanding of the source and the authority of that information. In the modern world, information is often repeated and is given a certain value because of that, even though it may or may not be necessarily factually based. And so, the concern also about forums. I think that one of the challenges, again, is that there are good things that come with people having an open dialogue and discussion, and then there is, of course, understanding who is actually participating in these dialogues and discussions, and further, what is that the agenda of the people who actually run the forums. So, without getting into specifics, I can tell you that, like yourself, a lot of patients who come to us have this type of concern, and I can tell you that if you're specifically talking about, let's say, just about the scalp, let's just limit it there, we have already enough experience of PRP in multiple areas throughout the body, and the history of PRP in the use in medicine began with oral surgery back in the late 90s, then went on to orthopedic surgery, and then went on to further into aesthetics. Now, interestingly, there was a tremendous amount of skepticism and resistance by plastic surgeons and dermatologists about the benefits of PRP, and in particular, about the benefits in hair loss. Recently, publications have been coming out about the benefits in PRP with hair loss, and remarkably, like the behavior of an entire herd, almost every patient who has previously had PRP injection will mention that they had a dermatologist do the PRP injection. which is kind of interesting because there were a lot of dermatologists dismissing PRP and its value. Nevertheless, as far as when you think of cancers in the scalp, you have to think about basically hair is a skin appendage, which means that you have to think of various types of skin cancers and the relative risk. Relative risk for skin cancers are essentially more related to ultraviolet light, such as sunlight or sun damage, as a source for conversion of particular cell lines into cancer. So the cancers that you have to be concerned about if you want to be checked include basal cell carcinoma, squamous cell carcinoma, and melanoma. Now, even though there may be some theoretical ideas around PRP and its role in causing cancer or accelerating cancer, I have not had any concern about that. I think that the mechanism of cancer has to do with more of a repeated exposure to something that converts cells through DNA damage into tumor cells. Now, PRP is derived from your own blood. And to go further now into the details of how to manage hair loss, and now I would say that I have no reservations with using PRP anywhere in the body, including the scalp. I would also want to give you some guidance as to what is the role of PRP in hair loss. To begin with, we have to understand that hair loss management has to be individualized. Everybody comes into the world, as I have observed, and we've been doing this particular treatment of hair regeneration for the past 7 years, and we have been treating patients from all over the world. Hair loss is expressed in different ways for different people, but there was one common reality. Hair loss is progressive. And when I look at people, I think of where do they fall in that relative amount of progression. So I look at patients in terms of age of onset, the age they currently are at when they come for consultation, the degree of hair loss, and then make a determination as to the relative aggressiveness of that hair loss. Now, the physiologic effects of PRP alone, in my experience, has been to be a short-term stimulation of hair growth. It doesn't necessarily stop the progression, but in a way indirectly appears to, because you start to get regrowth. The sustainability of that regrowth is going to be variable. And what I have observed now that more people are offering PRP is that patients are coming to me and basically expressing and relaying to me the general lack of experience of the doctor performing it. And I can understand that. When you are doing something like this, relatively new, you still don't understand exactly how it's going to behave until you have enough clinical experience. And I can tell you what we have done in our practice is we've done something called hair regeneration. Hair regeneration was developed from the observation that thinning hair became thicker when we used this material, extracellular matrix with PRP, at the time of hair transplant. Over the course of several years, I developed a system and protocol, and ultimately we've been able to manage and help people with hair loss, both male and female pattern hair loss. But then when we do this type of treatment, we're able to establish much longer term management of hair loss. And that is where there's a big distinction. A lot of people who go for PRP have to go with some frequency, either every month, every 3 months, and with no clear understanding as to what is the horizon of that continual treatment and what happens if you stop. With our system that we're doing, and like I said, we've been treating patients from all over the world, we have a lot of experience that we're able to provide our patients with more accurate prognosis and a proper approach that essentially is typically one injection and then we follow our patients for 5 years and see them every 3 to 6 months. And then in certain patients, we do something called a booster treatment, somewhere around 15 to 18 months, again, depending on their particular category of hair loss. So in terms of safety, I think you can put your mind at ease that it is a safe modality and it should not cause you to develop a malignancy. But I would recommend that you learn more about PRP, learn about your doctor's experience with this, and also learn about hair regeneration and the concept of using PRP with extracellular matrix in terms of the management of hair loss in your specific type. So I hope that was helpful. I wish you the best of luck. Thank you for your question.